Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about biomechanics of lumbar spine. So first we are having the kinematics. So there is a lumbopelvic rhythm, which is a coordinated movement of lumbar flexion and anterior pelvic tilting in sagittal plane during trunk flexion and extension. Bending to touch one's toe with knee straight. First bend force consists of lumbar flexion followed by anterior pelvic tilting of the pelvis at hip joint. So for approximation, the first 45-degree of flexion, extensor muscles maintain the ballast. Posterior ligaments become taut and facet of zygoepiphyseal joint come together and provide stability for disc, for joint, intervertebral joints, and then the muscle relax. So when the movement reaches the point where all segments are at full range, supported by posterior ligament and facet, the pelvis begins to rotate forward. That is anterior pelvic tilt. So glute hams control this movement, and the pelvis continue to rotate forward until muscles are at full length. So movement, flexion, extension, side flexion, and rotation. Flexion, there is anterior tilting and gliding of superior vertebra. Extension, posterior tilting and gliding of the superior vertebra. Lateral flexion, the superior vertebra laterally tilts, rotates, and translates over the adjacent vertebra below. Passive tension in annulus fibers, intertransverse ligament, and posterior trunk muscles on convexity of curve limit the lateral flexion. Rotation occurs as a coupled motion with the lateral flexion. So this is the figure in which it is shown that superior vertebra tilt laterally and rotate over adjacent vertebra below during the lateral flexion, and in the B part, lateral flexion and rotation are limited by tension in intertransverse ligament on the convexity of curve. So next we are having the kinetics. First part is compression, which provides support for weight of upper part of the body in static and dynamic situation. The increased size of lumbar bodies and disc in comparison with their counterparts in the region help the lumbar structure support the additional weight. The lumbar region must also withstand the tremendous compressive load produced by the muscle contraction. So with increased extension or lordosis, these joints assume more compressive load. With degeneration of intervertebral disc, the face joints will assume increased compressive load. Shear. The lumbar segments in the standing position, they are subjected to some anterior shear forces caused by lordotic position, body weight, and ground reaction forces. And this is resisted by inferior zygoepiphyseal facet of superior vertebra against the superior zygoepiphyseal facet of adjacent vertebra below. So it provides resistance to anterior translation during flexion, which depends on the extent to which inferior vertebra superior facets lie in the frontal plane. So more superior zygoepiphyseal facet of an adjacent inferior vertebra face posteriorly. So greater is the resistance. So there are some abnormal pathologies like spondylosis, spondylolysis, spondylolisthesis, prolapsed intervertebral disc, facetal joint arthropathy. So we are also having the lumbos. Thank you. ये क्या हो रहा है?